Yes, Assalamualaikum warahmatullahi wabarakatuh. So at this point of time, I will present my research on policy issues on COVID-19 waste comparing Indonesia and Taiwan. So this research is a collaboration research between Universitas 11 Maret, National Union University in Taiwan, and Universitas Muhammadiyah Surakarta. This presentation will be presented by me and my colleague Anissa Alia Mawati. So Alia, this time is yours.
Thank you for the time. I will start this presentation with introduction to the topic. As we know, since the appearance of COVID-19 instances in many regions of the World Health Organization has declared this a global pandemic disaster that announced in mid-March 2020. This pandemic became more dangerous and makes some multifaceted influence at all levels, which indirectly impact the world ecosystem. Pandemic gives several positive impacts to environment as reducing noise pollution below 60 decibel, where a study estimates the COVID-19 pandemic could potentially reduce up to 7% global emissions if the lockdown were extended until the end of the year. In addition, during the COVID-19 control period, air quality has improved tremendously. Meanwhile, there are negative impacts such as increase in environmental pollution due to the widespread use of personal protective equipment and related equipment during the COVID-19 pandemic. A significant increase in medical waste in the services of large hospitals and health centers will be an unavoidable result in modern societies around the world. According to Ocean Conservancy, since the pandemic began, humans produce 129 billion waste masks and 65 billion single-use clothes every month, most of which are not disposed of properly and end up in the ocean, which has broad impact on ecosystem and organisms. As you can see in the picture, it shows the data that obtained from our world in data 2021. It can be seen that the increase in confirmed cases and death rates in Taiwan is much lower than in Indonesia. This is also one of the variables that affect the increase in the volume of medical waste in the two countries. From February to May 2021, Taiwan produced 1.3 billion face masks. Each mask weighs about 4 grams, which can weigh up to 5,500 tons over 3 months. Meanwhile, the Ministry of Environment and Forestry of the Republic of Indonesia recorded that the total medical waste during the COVID-19 pandemic until July 27, 2021 reached 18,406. The study used 3 steps of the method. The first step is data collection. Data collected through data crawling in the research database and search engine. Unique keywords such as environment policy and COVID-19 waste were used. The second step is data analysis that the author employs a systematic review data by using computer-assisted analysis, i.e. post viewers and Google Trends. The last step is data display, which is the data collected will be displayed using graph and social network map. The next slide will be presented by Rino Ardianugroho.
Thank you, Alia. Now, I will present the result of this research. So this one, when we look at the Google and we look at search engine, we try to find the COVID-19 waste and government, and we look and we found that in Indonesia there's issued on guidelines on COVID-19 medical waste that is specifically used for the COVID-19 medical waste. Whereas in Taiwan, it is very hard to find the guidelines that is specifically used for the COVID-19 waste. Instead, they have medical waste, general medical waste that was prepared by the Environmental Protection Agency of Taiwan. So, based on these findings, we can conclude that Indonesia has a better policy guidelines regarding how to deal with the COVID-19 medical waste. And we try to look further by trying to find how the experts discussing this issue, and we find an interesting fact that most of the only 41 research conducting in both countries concerning about the the COVID-19 environment, Taiwan and Indonesia. So we'll use a unique keywords as presented here, and resulted only 41. When we try to look further, among the 41 studies using the first viewers, and we find the social network as presented here. We try to develop these social networks by entering all of the 41 research and try to find the node between the important terms in 41 research. And as we can see here, there's an Indonesia and Taiwan that is quite separate issues. And we try to look further within the networks and how both countries discuss what issues in both countries, and we find this finding. First, in Taiwan, there are some issues related to government, such as the healthcare facility, public health, government, development countries, management practice, but none of them discussing about the COVID-19 medical waste. So even though Taiwan has discussed about the government, but not in terms of COVID-19 medical waste. As well as if we look at the studies that is conducted in Indonesia, none of them discussing about the government at all. Most of them discuss about the effect of the COVID-19, like anxiety, tuberculosis, healthy behavior, and so on and so forth. So, based on the studies that has been conducted by the researcher, I can conclude that first, the Indonesia researcher mostly discuss about the health more frequently than focusing on mental health and some discussion of the physical fitness, whereas in Taiwan, researchers have a more diversified issues covering topics such as health, facilities and management, future pandemic focus, and so on and so forth. But unfortunately, I cannot find any significant research has been conducted in government policy regarding COVID-19 waste. And then we look for the Google Trends, and we try to capture how the public thinks about the COVID-19 waste. In both countries, there are no significant discussion or no significant search has been conducted by the public on the society regarding the COVID-19 waste. Most of them are still looking at the COVID-19 as seen in the blue line here, and whereas the red line is about the about the medical waste. Means that it has not been an issue by the society about the medical waste of COVID-19. Instead, they are more focused on the COVID-19 itself rather than on the medical waste. After all of those results, I can conclude that the study identifies that there are two countries that have contrasting differences on the COVID-19 waste issue, where Indonesia has more practical guidelines on how to handle the COVID-19 medical waste, while in Taiwan relies on general policy on medical waste. Secondly, when I look at the experts or researchers in both countries, it is safe to say that rarely concerned with the relationship between government regulation on waste, medical waste, and COVID-19. So this is quite interesting to see. And lastly, when I look at how the society thinks about the medical waste, they also doesn't have enough attention on the COVID-19 medical waste. They are still focusing on how to deal with the COVID-19, how the issues of COVID-19 vaccines, as well as general issues of COVID-19 and the statistic of COVID-19. Based on that, I can suggest further studies to look at it in a more broad and in a more insights of the differences on the COVID-19 medical waste policy between the two countries or other countries can be found. So I think that's all for me and my theme. So if you have any further queries about these studies, you can contact me through the email that is presented on the screen. Bye-bye.